their life with a balloon pump. So everything is getting a lot more technical now in the open heart units. You see these implantable, they call them ventricular assist devices, where they're putting like pumps inside the chest and allowing that to pump the blood to keep the patient going, and keep them alive. So it gets complicated at that point. All right, so when you're giving a report on your patient, make sure you mention the ratio. And what the ratio is, it's how often the balloon is inflating per how many contractions. So if the balloon inflates every single time the heart contracts, that would be a 1-to-1 ratio. Or it could be that every other contraction, the balloon will inflate. So that's how the patient is weaned off a balloon pump. It'll go from 1-to-1, give the heart a rest, and then the next day they'll change it to 1-to-2, and then 1-to-4, 1-to-8. So when it's at 1-to-8, it's only 8 only for once every 8 contractions that the balloon will inflate. And then if the patient still has good blood pressure with that, then they can take the balloon out. Okay, I guess it wants you to fill in the blank line with where you would place the balloon pump catheter. Do you know what vessel you would use?
The femoral?
Femoral artery. Okay. So write femoral artery in there. So when the balloon is placed, if it goes up too high, it occludes the arteries branching off of the aorta. So the subclavian artery can be occluded, so they have to be really careful where they place it. So they'll use fluoroscopy, continuous x-ray, in order to place the balloon. The patient must lie supine to prevent the balloon line from becoming obstructed. So when you have the catheter in the femoral artery, the patient can't sit because they'd have to bend their leg and that would kink the catheter. So their leg has to stay straight with their body. Now if somebody's lying completely flat, it's really hard to wean them off the ventilator because they're laying completely flat. So what I see them doing sometimes, since you can't sit the patient up, you can put the bed in reverse Trendelenburg. So instead of down like you would do CPT on the patient, reverse that and put the feet lower and the head up. So the whole bed is still flat, but the head of the bed is elevated. Now the diaphragm can work a little better for their breathing. So it's called reverse Trendelenburg to help with weaning. So in order to have that balloon sitting in the aorta, the blood has to be heparinized, where there's no clotting occurring at all. And of course, that's going to lead to complications. So if somebody has a balloon pump in and they order arterial blood, don't think it's okay to go and stick them in the radial artery, because they will never clot and they will continue to bleed and bleed and bleed. So if somebody has a balloon pump in and their blood is completely heparinized, you cannot stick them. You can't stick them for venous blood, arterial blood. The blood has to be taken from the A-line that's part of the balloon pump catheter. Does that make sense? Because that's a huge danger. That could happen to you guys in the ER also. If a patient comes in and they're possible stroke, one of the ways of opening up a vessel is to deliver a clot buster, streptokinase, TPA. But if you've drawn arterial blood and the patient's given streptokinase to try to open up the vessel in their brain, they'll continuously bleed where you stuck them for a blood gas. And it won't stop. There's no way of stopping it because you get rid of all clotting inside the blood vessels. So if the patient comes in as a stroke, don't think, oh, okay, they're going to need a blood gas, let me go ahead and draw the blood gas. No, because that's a danger. So You want to make sure if they're possible TPA for a stroke, then you do not draw any arterial blood. If they have a balloon pump in, their blood is completely heparinized, do not draw any arterial blood. It's possible with the balloon being in the femoral artery and going up into the aorta, that blood flow to the leg is compromised. And there's, I don't know how high the percentage is. Do I even have it written down? I have 14%, but that data is about 5 years old. I had that 14% of patients that have a balloon pump placed lose perfusion to their leg and have to have their leg amputated.
Oh no.
Yeah, I think it's a better percentage now, but
I hope so.
yeah. Can you imagine? Okay, we saved your heart.
But your leg's gone.
But your leg's gone. And then the second complication we talked about, which is hemorrhage due to heparinized blood. And then, of course, when you have any indwelling catheter going into a blood vessel, there's a possibility for infection to get into the blood, and then the patient becomes septic. Okay, so that ends our show.